Hi, so I'm gonna perform an inline suctioning. So first and foremost is read the patient's chart, obtain any necessary information. Once you're all done with that, make sure we wash your hands, sanitize it, and then wear appropriate PPE such as gloves, masks, and if possible, goggles. Once we're about to go inside the room, introduce ourselves to the patient, despite them still unconscious. Let them understand, especially also if there are relatives present, and then explain well what we're trying to do. And then make sure we check the ID band for confirmatory purposes. Once we're all done with those, we can proceed in doing our assessment by listening to the breath sounds, taking note of their ET level, take note of their SpO2 level and their heart rate, and also other information such as the patient's color and their level of consciousness. And then once we are about to start suctioning, reposition the bed elevated quite a bit, and then we can proceed in setting these supplies. This is the suction bottle, should be set up on the wall with a pressure of -100 to -120. And then in here we have this suction catheter, inline or closed suction. This is where we hook it up to the ET tube. This is the suction catheter, it's just being covered to prevent from any infection. And then this is the thumb port where we're going to press, and this thing is where we hook up with the suction tubing connected with the bottle. So first and foremost is make sure we hyperoxygenate the patient by pressing this increase in oxygen. If this is unavailable, we can try to press the knob and then turn it up to 100% FiO2. But just take note and make sure we never forget what's their intended FiO2 so that we can shift it up right after. So once we set that one up, make sure we insert the suction catheter, not too deeply, and then after we feel the first resistance, the other hand should be holding up on the port. We try to remove quite a bit if we feel any resistance or if the patient does cough. While withdrawing quite a bit, we should also press the thumb port and suction it up. So usually we do this one not more than 10 seconds, and also when we do suctioning part, once in a while, every attempt, let the patient rest, and then at least not more than 3 times for our attempts, just to avoid any complications such as bleeding, trauma, or any increase in their ICP. And then once we're all done with those stuff, take note also by doing our post assessment, listening to the breath sounds, checking the ET level, checking the SpO2 level, if it improves their heart rate, and also the patient's color. And once we're all done, remove the PPE, wash your hands, and chart everything what we did.